Very good morning, my dear learners, our esteemed alumni, and all the members of the fraternity of Indira Gandhi National Open University. I'm Dr. Sujata Hazarika, Senior Regional Director, and this is an invaluable opportunity for me to address all the learners who have taken admission and who are part of our journey with IGNOU. I've taken this initiative to reach out to you because there have been many instances where I've met learners who always felt that they are being left out from the mainstream education and they feel that they are not enough attached to the university. I would like to assure you that the University and Regional Center Kolkata is always with you. And we are trying our best and we are working relentlessly so we can accommodate all of you and support all of you in this journey that you have taken to make your education relevant, to make your education innovative, to make your education creative, and ultimately contributing to the nation building of this vast nation of ours. Understanding that the word open and distance learning module may sometimes make you actually feel that we are unreachable because we are not there with you every time on a day-to-day basis, or even sometimes on in the course of your entire program. But you have to see the benefit of this. The benefit is this, that the university believes that you are a matured, autonomous, responsible learner and you can take care of your own, you can take responsibility of your own destiny in learning. And so we let you be on your own, but we do not let you be left alone without any support. So in order to make ourselves much more accessible and to make you believe that we are always with you, we are undertaking a number of programs and outreach programs to reach out to you so that we can solve your problems, assure you that we are here, and address those issues which may be stopping you from your journey here. I would now like to welcome all of you to our periodic podcast, which is an attempt, as you know, by the Kolkata Regional Center to invite some of the outstanding individuals, some of the outstanding minds whose ideas and whose services can inspire and motivate our students. We invite them so that they can share their experience and we can also learn from how some of their areas of work can influence and motivate your lives. Nilanjana, thank you very much for coming here today, and I really appreciate your time. আমার তো মনে হচ্ছে যে there are so many issues that we need to discuss, and lately when I had my own discussion with you, I realized the potential and the necessity of why we need to bring this today at this podcast. So কয়েকটা জিনিস একটুখানি just to recap in my mind. Age related mind body specificities কয়েকটা জিনিস আছে which is a reality, and it's going to be significantly affecting our future society. And we also have a galloping technological prowess, lot of technology which is helping our life, lot of improved living conditions and also medical conditions. So aging is an inevitability and longevity is an inevitability. Now the problem is, how do we create social stability and how do we bring a balance between intergenerational interaction so that there can be a balanced family life as well as there can be a balanced economic ecosystem, so that the economics also doesn't change and the caregivers and the caretakers don't have a clash between them. I'm taking a very sociological view of why this is an important concern. Having said that, coming to know you, I felt here was an individual who was actually looking into this problem, and this problem is rampant and we need to bring out this problem as a general awareness. Firstly, how should we address dementia? What is the kind of public awareness? What are the causes of this disease? Another thing that I want you to tell us is there any kind of special relation between aging and dementia, or does dementia can happen anytime, or is there a specific relation between aging and dementia? too many things, you can understand that
Right.
I need, I'm myself very curious about how these are taking. So please tell us about it.
At the onset, let me thank you very much. We're really grateful for this opportunity, because I feel that dementia is going to be coming as an epidemic in coming years, all over the world. India more so, in the sense that India is experiencing a lot of changes in terms of family structure, in terms of its population. Even though we are a young country, we are seeing a significant increase in the number of people who are aging. So, given all that, and the other most important thing from the medical perspective is that uh, India is a country where we see a lot of vascular issues, so heart diseases, being diabetic. So, we are the diabetic capital of the world. Given that perspective, we are very much at risk of developing dementia. Now, when I use the word dementia, dementia is not a name of any disease. It is basically a medical term that is used by healthcare professionals. What they mean when they say that you are developing dementia, they mean that you are showing some signs and symptoms, and that signs and symptoms, they are increasing, gradually progressing. It is not staying, it's not steady, it is increasing, and it is affecting your daily activities. So bathing, eating, dressing, these are very basic things which we are so used to once we learn it. But then with dementia signs and symptoms, these daily activities are affected. Now, dementia has these 10 warning signs. When we tell people that these are the 10 warning signs that you have to be very careful about. So the 10 warning signs starts with short-term memory loss. It is not long-term memory loss initially when it starts. So what I had for breakfast today, I am not able to tell you. Besides memory loss, there is a problem with language. So I will have difficulty in expressing my views, my opinion, or my needs. So with language problem, you have difficulty with finding the right words. You also have a difficulty in constructing a sentence. Besides language and memory, you also have problems with judgment and reasoning. So, judging whether it's a warm day or a cold day, I will accordingly dress. But a person who is experiencing dementia signs and symptoms, if they are experiencing this particular symptom, they will have difficulty in judging in the environment and how they should dress up, or how they should, behave in a certain way. The other very, very significant change or symptom that we see in a person living with dementia is withdrawal from work and social activities. So they will gradually withdraw themselves from their regular social activities and also their work. So this is something that is very, very noticeable, when you see a person who is starting to experience this problem. Besides these few symptoms that I mentioned, some of the common ones are misplacing things, which I and you do a lot. I mean, I'm sure others do a lot. Absolutely. Now, whether that is dementia, because a lot of people say that I am misplacing things. So does that mean that I am developing dementia? Well, when I and you misplace things, what we do is we keep it in places that we are not able to find it at that moment, but later on we will find. And it is not something that these misplaced things are kept in places beyond our imagination. So a person who is experiencing the signs of dementia will keep things in places that are not supposed to be there. So for example, things that you would put into the garbage, obviously the person living with dementia will put that probably in the cupboard. Will not
categories have
absolutely. So these are some of the warning signs, and then there are a few more. But when we see more than 5 or 6 symptoms in a person, we usually tell the person to visit the doctor. Now, once they visit the doctor, they will go through series of tests. Basically, what the doctor will ask you to do is get some blood tests done so that they rule out some reversible causes of these signs and symptoms. So dementia signs and symptoms are also caused by reversible diseases. For example, thyroid, untreated thyroid problem, vitamin B12 deficiency, maybe a blood clot in the brain. These can also, result in dementia symptoms, but they are reversible conditions. So if you're treated for these conditions, your signs and symptoms will go away. But there are certain irreversible types of diseases in the brain that can cause dementia-like symptoms. And these irreversible diseases are, one of the most common form is Alzheimer's disease, which we very commonly know. And then there are vascular dementia, Lewy body dementia, frontotemporal dementia. So there are many, many types of dementias. So once the rule out is done that you are not you don't fall under the reversible types, then the doctor will go for some neuropsychological assessment tests. There will be some CT scans or MRI scan or PET scan for that matter. And the diagnosis of a particular type of irreversible dementia takes a long time because it is not, a very easy diagnosis. It takes a good amount of time. And as far as the treatment is concerned, unfortunately for the irreversible types of dementias, there are no complete cure at this point of time. For that matter, if you take arthritis or, some other diseases, there isn't any complete cure, right?
Absolutely.
So it is not that irreversible types of dementia, since it is not curable, there is not much we can do about that person. Just like somebody with arthritis, that person can still have a quality life, given we provide that opportunity to that person. It's the same with people with irreversible types. So these causes changes in the brain, these diseases, Alzheimer's, vascular, frontotemporal dementia, and these different types of symptoms are seen in different types of these diseases.
Is there a definite kind of a development from dementia to Alzheimer's, or is there for something can we make an inference like that?
Right.
So people with dementia will ultimately have Alzheimer's. Or is there
No,
any connection?
the fact is that it's like if you have fever today. Fever is not the disease, right?
Right.
So you go, it's a sign or a symptom. So you go to the doctor, a diagnosis is done, and you are told that you have, say, pneumonia, right?
Yes.
So pneumonia is the disease, and that needs to be treated. And that pneumonia is causing, one of the signs is fever.
Yes.
Same way, Alzheimer's disease is showing some signs and symptoms, which could be those signs and symptoms that I mentioned of dementia. So when a doctor says you have Alzheimer's type of dementia, it means that all those signs and symptoms that we are seeing in you is because of Alzheimer's disease. Right? So in terms of treatment, like I said, there is no complete cure at the moment, but there are certain medications which are given by the medical professionals, which is prescribed all over the world. And there are a few of them. What these medications do is basically treat the symptoms. They don't treat the disease. And therefore, we are not really finding a complete cure or, which we aim for. And I'm sure with a lot of promising research underway, there will be some big changes in how we treat these irreversible types.
Your center is a research center primarily.
Our center is not primarily a research center. Our center is basically a center that provides or extends care and support. So people living with Alzheimer's disease or other types of dementias will come to us, referred by the doctor. And then what we do is we kind of chalk out a care pathway where, based on the assessment that we do of the person as well as the family setup, also the physical environment the person lives, we will then come up with a care plan which will guide the family as to how to keep this person going with a quality life, right? So that is what we do, and we have all other kinds of supports in terms of counseling, in terms of training, people who are interested to be professional caregivers like me. I basically started as a professional caregiver way back in the 90s, and my aim was to be professionally trained to take care of people living with dementia as well as support their caregivers.
Yes, I see a very interesting degree which you hold, which is the Master of Management in Human Services, which is really, pardon my, of course, ignorance, but I really never thought that there was a Master of Management in Human Service, and which is so essential at this point of time. I think besides having every other practical disciplines that are claiming to have a lot of practical outcome, services is one area.
Absolutely.
Which is so important, because these cannot be done unless you have these services surrounding them, and calling it a human service, and that itself makes it so much more elevated. So I would personally like to congratulate you that you have done something as unusual as this, and I wish this would be also, our learners would also know that
Absolutely.
you have, because a lot of individuals have different categories, and by now we know that our brain has different faculties. While somebody may be very creative, other person may have no creative bone in them at all, and may be thinking very mathematically, analytically, and then you feel, আমার মধ্যে তো এই গুণটা নেই, আমি খুব ইমোশনাল, আমি লোকের জন্য আমার চোখ দিয়ে জল পড়ে, আমি খুব ভালোবাসতে পারি, এইসব কথাগুলো যেগুলো আছে, we have a tendency of putting them in the side and saying, তার মানে তুমি তো, you're not professional, you cannot be in the team of professional work. I want to point those out to those learners who feel a lot and want that kind, and have that kind of an orientation to spend some time, because these are very unique qualities in a human being, to be able to sit with somebody elderly, or sit with a small child, or even somebody with physical, any kind of challenges.
Right.
To be able to do that, these soft skills are so important in today's world. So, right?
Absolutely.
And I think it just digressing a little bit from your I had another question. What I understand is, for something like this to happen, we actually need a huge data bank, a research which is very substantial. And I'm wondering, what is the source of, you could be actually a source of a very good study. Like if anybody wanted to do a study, then you would be the data which will be providing everything about how a dementia patient behaves, what are the ways that you are dealing with them, that can be done. But besides that, which are the, how are we looking at these research? Where is the research? Because unless and until research actually takes place, we will not have much work, or we will not be able to contribute in the way that you are trying to contribute. Because your next challenge will be, when what are the inferences of research when you face a dementia patient? You will try to understand, how do I handle this dementia patient? Because you may not, if you don't have that much of body of research and inferences coming to you, books which have actually given some kind of an authoritative understanding of this area, you'll also find, because you're I think at the front level of actual service level. So are you happy with the way this entire research, or this is structured?
So in terms of research, there's a lot happening right now. But if we compare with the Western countries,
yes.
It is definitely, we have a long way to go. But I feel that there's a lot of research happening in India at this point of time. And the research is more medical than non-medical. So, there's a fair amount of work in terms of medical perspective when it comes to dementia. When it comes to caregiving part, like you said, you are absolutely right. There isn't a background information as to if I want to start my journey into this caregiving, pathway, what are the things that I start with, and on the way, what are the few things that I should keep note as I go ahead, right? So we as an organization, the organization that I represent, we do very small pilot studies, but I feel that big research papers need to come out, because we have been working in this area almost 25 years now, and we have a lot of data of family members of the person living with dementia, and professional caregivers like me who have been working in this area for quite some time, and we do have data. So say for example, I see a person not wanting to eat, right, at this point of time. So with our experiences, we are able to kind of gather the data that we have from the past experiences and put it right there and see if it is working. But my understanding is that experience, though it is said is the best teacher, to me, I feel that it is not always so, because in dementia care, there's a fine line and a fine balance that you kind of keep walking between missteps, meaning you'll make mistakes as you keep into this journey, and while you make that mistake, you also learn from that mistake and you achieve mastery. So this dementia care journey is a mix of missteps and mastery. It is not like there is a point of time when you have learned everything. Absolutely. And you are a master, and from then on, because every individual is different. Every person living with dementia, when walks into our center, we have to really think and act based on the data that we are getting from him right there, not based on what we already have. So that is what dementia care makes it even more challenging. I feel, going back to, when you were mentioning about my degree in Masters in Human Services, you see, when I was finishing my studies, I was, I knew that I wanted to work with the elderly people, because I had a great passion, and I felt that I would learn, given I used to spend a lot of time with my grandmother. But I realized that just having passion in something is not enough. Really having the tools to use your passion, to utilize your passion and make it more effective is important. And therefore that diploma or that master's degree, where the focus is that even though you're working in non-governmental organizations or dealing with the non-medical aspect of life, you still need to be disciplined, you still need to be a professional, you still need to have a strategy as to how you would do things, right? It cannot be ad hoc.
Absolutely.
So
and what a wonderful combination. You have strategy, you are systematic, at the same time you're intuitive and you are emotional.
Right.
So it's like coming together. It's not just empty strategies and professionalism and things. It's all coming together.
Absolutely.
Which makes it so beautiful, I think.
Absolutely. And caregivers, when they come to kind of join our movement, few of the skills that we really want them to develop is, number one is to be creative. Secondly, of course, to be curious. You have to have that curiosity. Absolutely. To solve problems. You also have to have common sense. So these are the 3 C's that I really emphasize on, because if you don't have common sense, which is actually mostly lacking in many of us, because we are not taught to think on standing on our feet. It is always somebody is going to tell me or feed me with information. I'm just going to do that, right? So we personally encourage the people who come. It could be an intern, or it could be a member who wants to join our center. We are always encouraging them to use problem solving skills. Unfortunately, that is not taught in our education system. It's more bookish knowledge. But how to solve a problem is what you need very early on. And I think going forward, young generation will have to really focus. Besides their studies, they will also need to really engage themselves in activities that are not bookish. They have to maybe volunteer somewhere and solving problems, right? And I think that is how they will understand the more holistic aspects of life, rather than just focusing on me and my right.
Thank you so much for channelizing this discussion to exactly this. What kind of people or what kind of citizens are we going to groom in future? The type of education that we've had so far, as you just said, it was hardly problem solving. Frankly, even a person who's gone through the highest degrees, when you came to life skills and life situation, you found yourself inadequate to handle those. So we are trying to change all that, and about the NEP now, which is really one of the most elevated vision of education that India government has just taken up. And everything that you're saying, and this program also is part of that, because we want to make our new age children or adults into a problem solver, into an innovative thinker, into an absolutely empowered with a lot of problem solving missions, so that you are practically grounded. At least the education is grounded. A number of us, at least the last generation, for all of us I'm talking about, when we finished our education, one of the foremost thing that was in our mind, either it would be, okay, where do I get a job now? I have to now start applying for jobs here and there, and you go frantic when you know that there are not enough jobs to accommodate. And the same story is continuing from now. The change that is happening today, and all our learners know about that. I'm sure you would know that we are trying to make that education more relevant. And hence, if you can see, that's one of the reasons why madam, you are here with us, because I'm also trying to show you how an collaboration is going on, and university is trying to take a step where the university is trying to see where the data can be found from, and which are the areas that the university can put their fingers on. So when you have an academia, an NGO, you have industry, when you have education, all in a collaboration, you have a fantastic ecosystem growing up. And that is what is the aim of this this entire education system that we are trying to grow. One of our visions of Calcutta IGNOU regional center out here is to do that, to have a collaborative approach of how we take our university to the learners, and also bring the society to the university. And that is where you are here today, because we want to understand what are the real life issues and how those real life issues can be communicated to our learners, so that they see an advantage and an opportunity there, and they can create an entrepreneurship model also from what you have done. This is a caregiving model, but it also has a potential and opportunity. As you said, the young people will come to you and they see an entrepreneurial model which can actually generate livelihood. You don't have to look for a job anywhere. There are so many people who need care, and the young ones who are in the educational, in that stage of life, can identify those areas, and you can make a profession out of that. And you can be giving the most meaningful profession that you can think of.
Absolutely.
Right?
Absolutely. I would just like to add few important points here. Number one is that this dementia population that we have all over the world globally now is about 55 million. Now this 55 million is going to go up to 131.5 million by 2050. Now, 131.5 million people, out of this, 68% of that population will be in developing countries like ours. And India currently has 8.8 million, which is about 90 lakhs of people living with dementia. This population is going to double by 2036, not very far away. Now, given the risk factors of dementia, which is lifestyle factors mainly, which is a concern in India right now.
Those are the causes?
Yes. So those are the risk factors that can, lead to developing dementia. So given the lifestyle factors, given that the dementia population is going to increase in coming years, it is the youth of India today that will have to take up the responsibility now, not wait when it is out there, now to decide how are they going to tackle this problem, because it is they who will be facing either themselves or they have to look after someone who is developing this condition, and therefore either way they will be held accountable. And hence I think if youth can get involved in this aspect, especially the brain health aspect, unfortunately all of us are trained to look after our body but not our brain. And therefore, absolutely, we take it for granted unless we see those warning signs and we realize that everything that we do, every thought, action is coordinated by our brain. And coming to the risk factors, which I think the youth needs to know and everybody else needs to know so that they can take, plan, good way. Number one risk factor is age. So as you age, your chances of developing dementia increases. And not that you will have it. So dementia is not a normal part of aging, but your chances increases as you age. So that's something that we cannot really alter. We are going to age, right? Number two is, of course, whether you are a male or a female. A female is more at high risk than a male in when it comes to developing dementia after a certain age, because women live longer. And also women have a lot of hormonal issues after midlife, which there's a lot of research going on to find out what exactly and how it is, it is connected. So there's a lot of research going on around that. We also have education. So the earlier you are educated in life, the better, because what you do is, if you are educated early on in your life, you actually build reserve in your brain, which can take you further. If you are not educated early on in life, then what happens is your reserve is not enough to sustain your whole life.
You mean formal education?
So this is a mix of, I think, yes,
learning.
I think lifelong learning. Lifelong learning is what is recommended.
I must point out here that IGNOU is actually one of the erstwhile proponents of lifelong learning. Some of our, our learners are 85-year-old. You're aware of that?
Yes, I am.
We have so many learners. We have women who are more than above 60, 65, and they're all into IGNOU programs.
And I think IGNOU is basically really highlighting what the rest of the society needs to focus, which is taking care of your brain health, irrespective of whatever age you are in.
Our MAPC program, just intervening in between, I'm so sorry.
No.
Our MAPC program, which is the Masters in Psychology, has the highest number of, applicants, and they also get, and it's a most successfully run program out there.
Absolutely.
What you are discussing here today is going to be so beneficial for this entire whole department. I'm so sorry.
Not at all. So lifelong learning is one of the preventive tips that we keep telling people, that it is not that you have finished your education, you are in a job, and you retire and you don't have to do anything. It is not. You have to continue learning, and that learning has to keep going. And the other thing, the risk factor, is sleep, your sleep health. So what we are noticing is that people don't sleep enough these days, and even if they're sleeping, that sleep is not sound, which is what we term it. So 6 to 8 hours of sleep is recommended if you really want to take care of your good brain health. Diet, a diet that is very rich in antioxidants, nuts, whole grains. These are things that are recommended. You would rather avoid the poison, the three poison, the white poison that we call salt, sugar, and flour, white flour. And physical exercise, I cannot emphasize more on this. there is a lot of connection. Research have really cleared it that there is a direct connection between the physical exercise that you do and the brain health. So 20 minutes of exercise every day is recommended for each and every one of us. It could be walking, it could be dancing, basically keeping yourself mobile, not sitting in one place in a chair for a long time is also recommended. So physical health, diet, the other thing that is recommended is social contact. So you really have to be socially connected with your family, friends, colleagues, the society at large, because it is the social connections that also keep you going mentally. And the last but not the least is mental stimulation, which will only happen through that lifelong learning, right? So if I want to be mentally stimulated, then I need to keep learning and really utilize my brain, because as far as I am aware, throughout our lifetime, it is only 5 to 7% of the brain that we utilize. The rest is not utilized at all. So the more we utilize, the more connections happen. Even it is said that with people who are experiencing dementia signs and symptoms, if their brain is stimulated well, then you never know, one part is damaged, but if the rest of the brain is not damaged, that part can get stimulated and that person can relearn certain things. But it has to be very consistent and very well chalked out stimulation. So there is hope, but I think the caution is the way India is moving forward with lifestyle. So your sleep, your eating habit, your physical health. I really feel the youth needs to take action right today, not to wait till they age.
Absolutely. At least there's an awareness thing now. It never happened earlier.
Absolutely.
Like our generation were not prepared to come and suddenly find, that our parents are suddenly becoming dementia and Alzheimer's. I was just thinking the other day, Alzheimer and dementia and even Parkinson's and all these, they look like age-related diseases. And if you look at it, I think the terminology became familiar. It is not more than 40-year-old. Before that, it happened to other people. It never happened to us, or it never even happened to anybody near us. It happened 40 years we started thinking that yes, there's something called this. And then probably we watched some Western movie or some Hollywood film which sort of showed some of these, and you became people forget or something. I remember one of our classics of Haranoshur, which was when Haranoshur came and you had Uttam Kumar forgetting everything. You thought, oh, this happens, like it really did it happen, something. This is so common now.
Right.
This is so common. It just, how you get familiar, and it was all lack of knowledge for us to.
Right. So, if you really take Alzheimer's disease, that is more than 100 years old. So it was identified more than 100 years ago. But I think understanding of the condition took a long time, because initially it was a very medical perspective. People are seeing more and more people are seeing it as a social problem, and you see, dementia can hit anyone across the society, irrespective of caste, creed, economic background, ethnic, ethnicity.
And age, is it not age, of course?
So
can it happen to younger people?
Yes, it can happen. So initially, when we started as an organization 25 years back, till about 10 years down the road, we would have people over the age of 65, which is typically the age that it is said the prevalence starts. But now we have people as early as in their late 40s, early 50s. And this is because, you see, in India, it is not Alzheimer's that is so much we see. It is vascular dementia, because of those all vascular issues that Indian population is suffering from. So with vascular dementia, basically strokes, minute strokes, small strokes are in the brain, and those strokes cause the damage. And that can happen at as early as 40s, right? And so we are actually getting a lot of people in their early 40s and 50s coming to us with vascular dementia. So I think it is not that only elderly people have it, it is also young people. And I think young people, given their lifestyle factors, they are more prone to developing this, unless and until they really take care of their overall health. Well-being is extremely important, and therefore I think I cannot really emphasize more on how much brain health is going to be taking a huge aspect of preventive diseases, right? And there are a lot of campaigns that are going on around prevention. Because we don't have a cure at this point of time, the whole focus is on prevention now. And that prevention can start as early as in like school children. So, physical exercise, diet, sleep, all these should start at a very early age. You don't need to be 40s and 50s to really think, okay, I need to exercise now, right? So, so I think these are some of the initiatives that need to be taken up, by the society at large.
At
and
large.
and we really need to. When you mentioned how IGNOU focuses on lifelong learning, I think through collaboration, one of the most important initiatives that could be taken up is creating a dementia-friendly society. And this, when I say dementia-friendly society, I mean the physical environment, the emotional environment, and the social environment around us will be equipped with tools and information and equipments that will help anybody with any of these kind of diseases to function till the end. Because at this point of time, when somebody is living with the condition, family members are not willing or do not feel capable, or they're not willing to take that person out of the house because they're not sure how that person will be accepted, or whether there'll be challenges outside in terms of physical environment, right? So I think the youth could take up a challenge of creating dementia-friendly society that would ensure that irrespective of the disease condition, people with dementia can continue to live a very enriching life till the end.
Hope so about that. And that brings us to this question about Bengal right now. Since you've been working out here, can you give us a kind of an overview about what is the status of dementia in Bengal?
So compared
and
to
what are the specific challenges, if
Right.
you would like to emphasize on, especially for Bengal?
Right. So in terms of the numbers, if I go into statistics, there are no clear statistics. But if I compare with the national or the India population of dementia people, India, West Bengal elderly population is very high, and therefore proportionately we feel that the dementia population should be a significant number. Way back, I think it was in the early 2000 that an epidemiological study was done by Dr. S.K. Dash, and it said about 40,000 people in the city of Kolkata has dementia. All over West Bengal, about 80,000. So that was way back. Not sure if
that was in the year
early 2000.
Yes. Okay.
And therefore we don't have much information as to what numbers have changed, but definitely there is a significant increase in the number. And in terms of support, access to care, if I come to access to care or medical care, then there are excellent doctors, medical professionals here that can do the diagnosis, that can really help a family member, can navigate the medical diagnosis part. In terms of caregiving, I would feel that we need more organizations like ours to come up and initiate a lot of programs. There are some. In my 25 years here, I have seen a lot of new organizations that are coming up. the focus is more on care rather than a holistic approach, in the sense, as like for our organization, we do awareness, we do memory screening, we do counseling, we do daycare, we do home companionship, we do publications. So it's more holistic approach to this problem. Most of the other organizations that have come up are more into the caregiving part, so they only provide the care aspect, but there are many that are coming up. In terms of involvement, the community has really come forward, very slow, but have come forward. And I think it will take time, because as we all know, awareness and stigma plays a huge hurdle here. Unless and until you as a person have somebody in the family going through the problem, you would not really want to come out and try and understand it, or feel that you have to contribute. It is only the family members who go through this want to come out and help. So in terms of awareness and stigma, we have a long way to go. Number 3 is in terms of infrastructure, in terms of, say, residential care homes or daycare. So as far as I'm aware, there are, I think, couple or less, maybe one daycare center in the whole city of Calcutta. You need so many daycare centers. Yeah, I am aware of ours. I am not sure if there are others in the city of Kolkata that are running like we do. And imagine a city of Kolkata, you have one daycare center, and that is one of the reasons why people from, say, the northern part of Calcutta struggle to come to us, because we are situated in the south of the city. So we need more infrastructure in terms of providing care to the person living with dementia, as well as the family members.
This is also an opportunity for any new entrepreneurs to come up.
Absolutely.
Because you're saying there's so much
to do.
This is for anybody who's listening to this podcast, and as part of the innovation, entrepreneurship model that we're thinking of, this is a huge opportunity which is present there, and you can go for certain programs which can train you on these expertise. I'm sure these training programs can be taken, and IGNOU itself has a number of training and programs which are related to psychology. I'm sure internships can be seasoned out like that. Right. So you could think about those areas.
Absolutely. I think when you talk about collaboration, it could be where you have an existing model where the psychology module that you have, a part could be maybe 60 or 30 hours of practical.
We do have that. We have we have internship, and we have practicals, and that is where we are also in the process of identifying proper places where our students can be trained.
Right.
To go there. So your center is also something which has come into my vision in that way. That where can we put our students so that their internship and their training in IGNOU can be fruitful. So these are some of the credible places that we are looking to train our students also.
Absolutely. Because we do provide training. Those who want to become professional caregivers, also family members who want to train themselves up. So when you talk about somebody wanting to really be a professional in the dementia care space, they could be trained, and they could think of starting their own initiative. Absolutely. Where they can build a team and provide the care wherever they want to, right? So infrastructure wise, there is a lot to be done. It's actually a whiteboard now. So that's about the care aspects. I personally feel that the government of West Bengal would really need to take the initiative of at least help the society in terms of raising awareness, in terms of getting the diagnosis done well, and also in terms of making people access care side. Kerala is the only state in India that has the Kerala State Initiative on dementia. And what they have done in this initiative is that they have these 3 aspects. So awareness and stigma reduction, you have diagnosis and care, and then you have training. So these three are the
Yes,
state
absolutely.
has taken up, and I feel that it has been quite some time that if we have been trying to really associate ourselves with platforms where we could get in touch with already existing people who are there available, who we could train up, who we could raise awareness, and they would then go and raise awareness. So it's more of train the trainers program.
Yeah, right.
And I think Bengal needs to really catch up on this aspect.
A number of our, as I was just saying, our learners, sometimes they look for internship, and I would like to, inform all of you here. Please be very, very focused and conscientious and also committed in the internship projects that you take up, because let it be worth the time that you are spending. And that's one of the reasons we were trying to bring proper, we have National Library is going to be very soon with us for the library science. We've got, organizations which are also, your organizations there. There's some couple of other organizations who have proved themselves over time by their dedicated service. And I would like to inform all of you that you must be very careful about where you put your internship time. Very soon you'll find, when you come out of, as I was telling you, when you come out of it with a degree, you should be in a position where you are not only employable, but you are able to generate employment to others. That is what is more important. And that will only happen if you have a very solid internship program.
Absolutely.
And our NEP, even the education policy nowadays, they're emphasizing a lot on internship. Because we've also done that. We finished our graduation, just finished our degrees and thing, and then suddenly came out and what do we have in hand?
Right.
You're not ready for anything.
Right.
So that is something,
Absolutely.
you learn as you study.
Absolutely. That is what the model should be. As you are studying, you explore areas that you would like to try your hands on.
Right. Absolutely.
So it could be elderly population, it could be children, it could be women, whatever aspect of life that you want to focus on. And I think trying out, it is not that exactly for sure this is what you want to do. If you know, that's great.
Mm-hmm.
But if you don't, then it is better that you try out various things, try your hands on these different initiatives, and see where you are more at ease, where you feel that you are going to learn more and more. Because I feel that when we are students, we are students all our lives, but I think when we have an aim in life, a goal in life, we also have to be very clear as to why am I wanting to intern here? What am I going to get out of this? And what am I going to contribute to wherever I am there interning, right? So, say for example, I am not a medical personnel. I was trained as a caregiver, and when I came to Kolkata here, I decided that with my caregiving background, I could extend care and support to people and family members. And this is how I began with just myself for probably 2 years. It was just me visiting families, talking to families, holding awareness sessions. And then we started to hire people to a point where we have a huge team now working, right? So I think it is not impossible to create your own institution, to create your own space where you do things that you believe in. And I think people who are serious about what they want to do, how they want to contribute in life, it is important that you do a lot of what I say self-reflection. I think that is very important as a human being, that you reflect what you are thinking, what you are doing, what you are saying, and that helps you to develop. There is no harm in making mistakes, but then if you are not learning, if you dare to learn from those mistakes, you actually will definitely succeed.
That's a wonderful note of self-reflection. That is so true. To be conscious of every action that you are into.
Absolutely.
I have no words to thank you for this wonderful time you've given IGNOU Kolkata Regional Center, as well as all our learners and all our The entire IGNOU fraternity will be looking into this, and I'm sure it's going to benefit everywhere. As you know, our regional centers are all over in the country, so we are going to share these with all our regional centers all over the country now, and that's how the outreach is going to spread. Thank you so much, Nilanjana Maulik out here, and I hope that some of our students will choose to intern and do some of the quality work that you're doing right
Absolutely. I always feel that the end of any talk that I do, or any seminars that I would like to hear back from at least one or two people that is there something I could do.
We will share Madam's email for any of the learners who would like to reach out to her. So when we share it, we will share her email there.
Right.
Thank you so much.
Thank you very much.